Do you have a high blood pressure or maybe pain on your chest? Then it might be that your doctor has prescribed you Atenolol. In this video we will cover how and when to use it, what side effects it can cause and much more. So make sure to watch the whole video so you don't miss any important information. And for those of you meeting for the first time, my name is Raoul, I'm a medical doctor from the Netherlands and it's my mission to medically educate you, my viewer. But remember, I'm just a random doctor from the internet. I know nothing about your personal situation, so always ask your own doctor for personal questions. Let's get started. So as mentioned, the generic name of this medication is Atenolol and is available under the brand name Tenormin, available as a tablet. If you want to use it, just swallow it whole with half a glass of water. And remember, it's also important to take it at fixed times. This will make you less likely to forget a dose. Atenolol is part of a group of drugs called beta blockers. These reduce the workload of your heart and widen your blood vessels, causing your heart to beat slower with less force. Therefore, Atenolol can be used to treat high blood pressure, pain on your chest called angina pectoris or arrhytmias. Which brings us to what dosage should you use? And here I want to mention that I can only provide you with some guidelines. Always use the prescribed amount and frequency your doctor gave you, as your dosage might depend on the indication of use, the side effects you might experience and the severity of your symptoms. However, in adults, most doctors will start with an initial dose of 25 milligrams once per day. If necessary, this can be further increased up to a dose of 50 to 100 milligrams once a day. Now, Atenolol can be a very effective drug, but unfortunately it can also cause some side effects. I will discuss the most common ones in this video, but if you're looking for a complete list, ask your doctor, your pharmacist, or check your leaflet. Commonly it might cause a slow heart rate, coldness in your hands or feet, nausea, vomiting or diarrhea. Uncommonly it can cause hallucinations, psychosis, depression or nightmares. Rarely it might cause a low blood pressure, heart failure or visual disturbances, and very rarely it can lead to libido disorders. Which brings us to the safety of use. Now please be careful the first few days you're using Atenolol, as it can cause you to be dizzy or fatigue. If you experience these side effects, then please do not drive. Furthermore, alcohol widens the blood vessels. It can therefore increase the side effects of dizziness at the beginning of your treatment with Atenolol. Try drinking alcohol in moderation so you can estimate its effects. Atenolol could also have some interactions with other drugs you're taking. Always discuss this with your personal doctor. And for those of you that are pregnant or breastfeeding, please do not use Atenolol. Always discuss this with your personal doctor, as this could be dangerous. Now, I hope you know now how to use Atenolol, but if you have any questions, let me know in the comment section. For those of you that want to keep on learning, check out the playlist in the description with more videos on cardiovascular risk and cardio-related problems. If you did enjoy it, please leave a like. This will help out the channel tremendously, and consider subscribing. I'm posting awesome weekly medical videos which can help you to increase your medical knowledge. I want to give special thanks to my Patreon supporters. Thank you, Sebastian, who is an University supporter. And for those of you that can't get enough, check out the Instagram as well, @howtomedicate. I'm posting there quite regularly now. We'll see you next week. Bye bye.